Great. So again, welcome to our webinar on how to write a conference abstract. We'll be organizing a series of other webinars throughout the next few months, leading up to our virtual conference in September for early career researchers, clinicians, and community-based leaders from across the disciplines interested in mental health in Southeast Asia. And today, I'm really happy to be able to introduce Dr. Elena Lesley, who is leading our webinar on how to write a conference abstract. So you can see Dr. Lesley has her camera on. She is a psychological and medical anthropologist whose research focuses on cultural and spiritual adaptation of mental health treatment. She received her doctorate in the Department of Anthropology at Emory University. Dr. Lesley worked as a researcher at Princeton University, and as a professional journalist before beginning her PhD studies. She has also contributed to different projects in Cambodia over the past 18 years, has also conducted research in Malaysia, Rwanda, Tunisia, and Estonia. And after the presentation today, we'll have Q&A. So I ask that you keep your microphone muted during this presentation. During Q&A, if you have a question, please raise your hand or type your question into the chat. You may feel free to use your local language. You do not have to use English if that's what you're most comfortable with. And our conference staff who are here today, which include Mai, maybe Mai, you could wave or maybe give some indication, and Buna, who can perhaps also wave and give some indication. Thank you. We'll note down your question in the order that they're received, and Dr. Lesley will answer those questions after her presentation. And either Dr. Lesley, myself, or Dr. Sinu Thine, who is also here with us today, could also answer some of your questions during Q&A. Again, thank you so much for joining. To you, Elena.
Thank you so much, Dr. Trang, for that lovely introduction. I am going to try to share my screen now with the PowerPoint. This is the second time that we have held this webinar, and I can see we have a little bit of a smaller group this time, but maybe that will make for some great discussion. So that's nice, and you can ask any questions you have. Dr. Trang, let me know if the slides aren't advancing for any reason.
They seem to be displaying and advancing.
Awesome, thank you.
Oh yes, and I would also like to point out, as Dr. Thine Lemelson has pointed out in the chat, Dr. June is also here and can offer Burmese translation for folks who want to ask questions in Burmese. Thanks so much.
Awesome. So we are holding, oh, sorry, didn't mean to interrupt.
Yes, I just want some Burmese folks here that if they have some translations, I'm here to help. So, Myanmar via journey ရဲ့ ပြည်များရှိလို့ရှိရင် Myanmar translation လေးလိုလို့ရှိရင်ကိုညီပေးနိုင်ပါတယ်လို့ဟုတ်ကဲ့ပါ Thank you, Elena, back to you.
Yes, thank you so much. So we are holding this webinar today as part of a larger initiative, the Southeast Asian Mental Health Conference, which is an event that is going to be held September 10th to 11th of this year, and that is going to be in Southeast Asia time zones, held virtually this time, but our plan is that for this to be part of a larger initiative that will eventually be a biennial conference, so that will happen every 2 years and that will take place in different locations in Southeast Asia. And you can see here we have the website. If you don't already have the website address, please note this down. And the virtual conference that's happening this year will include presentations, training workshops, and social mixers. And this conference is focused on Vietnam, Cambodia, and Burma and the Burmese diaspora. However, we are also happy to get submissions and participants from other countries in Southeast Asia as well. And we're hoping to eventually expand the effort to other countries in Southeast Asia. There are a number of different opportunities that will be involved with the conference. International experience and exposure, getting to have discussions and network with scholars from a number of different countries and world areas. Prizes, we are going to award travel prizes to the top 5 presentations at the conference, and these prizes will fund a trip to an international conference of the winner's choosing. Mentorship opportunities. There are a number of different mentorship opportunities involved with the conference, and one that we'll talk more about today is the abstract mentoring opportunity. Those of you who are not that familiar with writing conference abstracts or academic abstracts, and you may want more assistance with that, we will pair you actually with a mentor who's a more advanced scholar who can help you in that area. And then also skills-based workshops that will be training sessions that will be leading up to the conference and then also happening the days of the conference as well. And if you look in the chat as well, Mai has put more information about the conference, including the website, email address, Facebook page, and Twitter. So we are trying to reach out to people from a number of different venues. And in addition to including different countries in Southeast Asia, we're going to also have a number of different mentors from universities in the United States, including Yale, Florida State, Emory University, where both Dr. Trang and I did our PhDs, Boston University, and others. So moving into the nitty-gritty of abstracts. The abstracts submitted to this conference should be approximately 200 to 300 words. They should introduce, I have either here the journal article or presentation, because abstracts, as many of you may know, are often used for journal articles, but can also be used for presentations at academic conferences. Inform readers about the content of the article or presentation, and also help readers or audience members, in the case of the conference, decide whether or not the subject is relevant to them. What are the features of a good abstract? A good abstract should stand alone, providing a coherent narrative for the paper or presentation, follow an organized introduction, body, conclusion format that follows the structure of the paper or presentation, does not add new information that's not present in the paper or presentation, so it's not just a place to put extra information, and also should be understandable to a wide audience. Other features of a good abstract, it should have minimal references. This doesn't mean necessarily that there shouldn't be any references, but usually there should just be one or two if it's a major focus of the paper or presentation. No tables or figures, no or few abbreviations, and any should be introduced before they are used. And the conclusion should be based on the results presented in the abstract. I'm sorry, did anyone have any questions up until now? Okay, and also is my pace okay at which I'm speaking, or would you like me to speak more slowly or faster? If anyone has any thoughts on that, feel free to share them. So far, so good. Great. Okay, because I know not everyone is a native English speaker. So thanks, Buna. So what abstracts are not? As I mentioned before, they should not be extensions of the article, not a place to just put extra information that doesn't fit in the main text, a summary of every minute point in the article, much shorter or longer than 300 words, or lacking sufficient information for a critical evaluation of the research methods and results. So for example, mental health quantitative study should include the names of the measures used. A qualitative mental health study should include the sample size, the method of recruitment, and the analysis approach. Different types of abstracts. They can be abstracts for research that was conducted, that can be qualitative or quantitative. These kinds of abstracts present results from primary or secondary data analysis. There should be at least preliminary results included. Also clinical case studies. These are often done by practitioners, and these increase awareness of a condition, unusual presentation of a condition, suggest proper outreach, screening, diagnosis, or unusual complications associated with managing a condition, and deliver some message or lesson. And then also community-based case studies. These present findings from or lessons learned from implementation of community-based programs providing care or screening for mental health-related distress. Now moving on to how to write an abstract. An abstract should contain a title, background, research questions, methods, results, and conclusion. So roughly 1 to 2 sentences describing the background for your research topic, research question, and hypothesis if relevant. 1 to 2 sentences describing the research methods you used. What did you actually do? 1 to 2 sentences describing the results or findings. If it's a quantitative study, remember to report statistical data. And 1 to 2 sentences for your conclusion that includes future directions and takeaways. Another way that I like to think about the breakdown of an abstract is by percentages of text. So if you think of the abstract as being roughly 200 or 300 words, then of that chunk of 200 to 300 word text, roughly this percentage would be devoted to each component of the abstract. So roughly 25% to the main problem or background issue to be studied, roughly 25% to the research design and methods, roughly 35% devoted to findings or results, and roughly 15% devoted to the broader significance and the relevance of the research. What's a good title? A good title should provide a very brief summary of the research. It should specify a number of key elements, including the population, the country where the study was conducted, and any other crucial information, and indicate the topic or results in some way. And also a good title should help people decide if the article or presentation is relevant to them. How to select keywords. It's also often helpful to include keywords with your abstract. So pick 5 concise, clear, descriptive words that best describe your work. What words would return your abstract if you were to type them into a search engine like Google? So some good examples are keywords such as mental health, qualitative, adolescence, Thailand, and e-health. Examples of bad keywords, because they're either not clear or specific enough or too specific, would be study. That's of course way too broad. 14-year-olds, maybe way too specific. Asia, way too broad. And then Bangkok, maybe way too specific, depending on what the study is. Now I'm going to go into an example of an abstract and then break it down into its various components. And hopefully you can use this as a guide if you're not that familiar with writing abstracts in terms of how you would write your own abstract. So as you can see here, this is a roughly 300-word abstract. And when you look at it, it's just a big chunk of text. And I know when I was first starting my PhD studies, I would look at something like this and I just wasn't clear at all what needed to go in the abstract, like of this research that I did and that I wanted to present, what components were actually completely crucial to have in the abstract and how should they be presented. So that's what I'm going to try to go through here. So this abstract is from the journal Frontiers in Psychiatry, and the article is "The Effect of COVID-19 on Mental Health and Well-Being in a Representative Sample of Australian Adults." So as I said, the idea here is that I'm going to break it down into its components. I just liked this graphic because I feel like this sort of sums up my approach to everything that I do in academia or in life when I find a challenge, is that I try to break it down into smaller sort of manageable components. And then in that way, I'm able to solve it, or in that way, I'm able to replicate what I have seen done so that I can follow the correct format myself. So to start off with, the first component, this is that roughly first 25% that I was discussing, that should be a brief description of the main problem or issue to be studied. If you look at the chunk of text we were just looking at, this is roughly the first 25% of it. There is minimal knowledge about the impact of large-scale epidemics on community mental health, particularly during the acute phase. This gap in knowledge means we are critically ill-equipped to support communities as they face the unprecedented COVID-19 pandemic. This study aimed to provide data urgently needed to inform government policy and resource allocation now and in other future crises. So you can see here, there's some background and also the important gap in the literature and knowledge that this study is going to confront. Then the second component of the abstract, also roughly 25%, a description of the research methods and design. This study was the first to survey a representative sample from the Australian population at the early acute phase of the COVID-19 pandemic. Depression, anxiety, and psychological well-being were measured with well-validated scales. Using linear regression, we tested for associations between mental health and exposure to COVID-19, impacts of COVID-19 on work and social functioning, and socio-demographic factors. So you can see here, there's a real, very clear description of both the methods that were used, the scales that were used, and then also the forms of data analysis that were used. And then we move into the third component of the abstract, which should be roughly 35% of your abstract text, which is devoted to findings and results. Depression and anxiety symptoms were substantively elevated relative to usual population data, including for individuals with no existing mental health diagnosis. Exposure to COVID-19 had minimal association with mental health outcomes. Recent exposure to the Australian bushfires was also unrelated to depression and anxiety, although bushfire smoke exposure correlated with reduced psychological well-being. In contrast, pandemic-induced impairments in work and social functioning were strongly associated with elevated depression and anxiety symptoms, as well as decreased psychological well-being. Financial distress due to the pandemic, rather than job loss per se, was also a key correlate of poorer mental health. So here you can see they've really pulled out some of the key findings from the data that they collected and analyzed. Probably not all of their findings, but the ones that they felt were most important. And then finally, the fourth component, or roughly 15% at the end of your abstract, should be devoted to the broader significance or relevance of the research. For example, these findings suggest that minimizing disruption to work and social functioning and increasing access to mental health services in the community are important policy goals to minimize pandemic-related impacts on mental health and well-being. Innovative and creative strategies are needed to meet these community needs while continuing to enact vital public health strategies to control the spread of COVID-19. So here you can see that they really try to point to the broader significance and how this might influence public health strategies in the future. Now I'm just going to go through a few different examples, and because there will be a recording of this webinar, you can go back and look at them and pause the screen in more detail if these more closely mirror what you're hoping to submit and if they'll be useful guides. So this second example is an example of a qualitative study that you might submit. This is the example of a systematic review abstract that you might submit. And then finally, this is an example of a community-based case study abstract that you might want to submit. Should you choose an oral or poster presentation? What's the difference? We're going to have both at the conference. So you could theoretically either apply to both. Apply to either of these. First, for oral presentations, you will be giving a 10-minute live presentation with PowerPoint, followed by a 5-minute Q&A. You will be on a panel with 4 to 5 other people and an expert discussant. In contrast, for a poster presentation, you will be one of many people in a virtual room and will give a walkthrough of your poster when, if approached. Each poster session is 1 hour. Generally, if you have fewer results to present, for example, if your research is more preliminary, we suggest a poster presentation. However, keep in mind that only the oral presentations are eligible for paper prizes. So those are the prizes that I mentioned at the beginning of the webinar that will pay for your travel to an international conference. And 5 of those prizes will be offered this year. This is an example of a scientific poster, which, as you can see, has an abstract, as we've been talking about, would also include a visual representation of the introduction, methods, results. So you could put tables and figures there, and then also your major conclusions. As I mentioned before, there are a number of different opportunities for mentorship. And we're actually really lucky to have already had quite a few senior scholars volunteer to donate their time to mentor people for this conference. And if you would like to have a mentor to help you write an abstract, there are a few different ways that you can make this happen. We would prefer that you request a mentor through the Google Doc here and use that form. That would be the first way to try it. If you have any trouble with that for some reason, you could also email us at this Gmail address. And then if there are any people watching who are more senior scholars who feel that they would be qualified to mentor, you can also use the Google Doc pasted here to sign up. A few frequently asked questions related to the conference. What disciplines does the conference target? We welcome people from all disciplines, provided their work is relevant to mental health. Can I submit an abstract for an in-progress work? Yes, as long as you have preliminary findings, you can submit an abstract. Can I submit an abstract for work that has not yet begun? While you can submit an abstract for a proposed study, we highly encourage you to submit an abstract with some preliminary results. Can I submit an abstract for a literature review? Yes, literature reviews are welcome. Can I submit an abstract if I am an undergraduate? Yes, you can submit an abstract irrespective of career stage. Do I need a more senior co-author if I'm an undergraduate? No, that is not necessary for abstract submission. When deciding who should be a co-author, please follow the conventions of your field. Can I submit an abstract for a qualitative study? Yes, absolutely. Many of us conduct qualitative research, and we are always excited to learn about qualitative research in other parts of the world. Any other questions? Thank you so much. That is my introduction to conference abstract writing. Thank you. And yeah, so if you have any questions, if there was anything that was unclear to you or just any issues that we didn't discuss yet, please let us know. I don't know if we have any questions to start off with in the Google Doc.
Yes, there are two questions that are currently in the Google Docs, so I'll just maybe read them aloud, and then folks can just feel free to also, if they have any questions, just note them in the chat, or feel free to raise your hand and we'll get to you. So the first question is, what is the acceptance rate for this conference?
Well, I don't think that we can really know yet what the acceptance rate will be, because I think it will depend on how many submissions we get. Dr. Trang, you can contradict me if I'm wrong, but that is, I think that we will certainly try to accommodate as many people as we can, but we may have to reject some abstracts if we do get an overwhelming amount and it's not possible to find a place for all of them.
Yeah, I think that's a great answer. And I think, we will definitely try to accommodate and work with people. And, I definitely, but we can't say beforehand what the acceptance rate might be.
Yeah, I mean, also since this is our first time doing the conference, we don't really have a past conference to use as a metric. The second question we have is, does the study need to have a real impactful finding to submit? I'm not really sure exactly what you mean by impactful finding. I don't think that if you mean, does it have to necessarily have a very significant real world impact, that would be nice, but it's not required. It could definitely be something that's more preliminary, or even something that's more theoretical. So it has an impact in your discipline or in a particular body of literature, but may not necessarily have a really broad impact. Dr. Trang, I don't know if you have any different ideas on that.
No, I think that's great. And I think if the question is related to whether you can submit results that are non-significant, in terms of like quantitative results that are non-significant, I think that's perfectly fine. We definitely welcome null findings as well. And I think that can definitely be exciting, particularly, if you're not observing significance in a relationship that you expect to see such a relationship. So I think that I would welcome, whatever you think might be of interest and related to mental health, and not assume a priori whether it's significant or not significant, or impactful or not impactful enough. Dr. Thailamson, I don't know if you have anything to add.
No, I think that covers it, and that's excellent that we're accepting the null findings too. I think that'll really open it up for everyone.
Yes, definitely. So we definitely have a pretty inclusive approach.
Any other questions from folks currently in attendance?
Don't be shy. If you have any questions, feel free to ask. But you can also always email us later and get in touch with us if anything comes up. Or as I mentioned before, really consider signing up for the abstract mentoring program. We have a number of really great people who have already volunteered to help with that. And we're going to do our best to try to match people based on their areas of interest and similar research areas. And the Google form does actually request some of that information. So if you sign up through the Google form, please include that information.
So Dr. Lesley, so long as no one else has a question,
Sure.
I'm wondering if you and Dr. Trang can go over for people why they should want to present at an academic conference, especially if they have not done so before.
Well, I can think of a few different reasons, and thanks. That's a great question. I guess that I've been presenting at so many conferences over the last decade or something. It didn't necessarily occur to me that people might not understand why. There are a number of different reasons, but I think that one of the major ones is to be able to figure out how to articulate your research and findings in a way that is understandable to people from different disciplines and different backgrounds. And also, so a big part of it is communication. And then another big part of it is feedback, is that you'll be able to get valuable feedback from other scholars, both from other countries in Southeast Asia and also from the United States. And you never know what kind of feedback you might get at a conference, and especially people from different disciplines might have a really different take on things.
I would add on to that, I think many of us right now, or like many people, and this is really also one of the impetus behind the conference overall, which is that I think throughout the years of having worked in Vietnam, in particular in my case, we've noticed that there's a lot of people that in some cases are working in the field of mental health or are directly dealing with mental health related issues in the context of their clinical work or community-based work, and not really necessarily sure how best to kind of navigate that space, or what are the best evidence-based practice to address the issues that they're currently confronting. And I think that a conference like this allows for them to really interact with their peers who are dealing with similar issues in the context of their work, whether in a community setting, a clinic-based setting, or in a research setting. So I think more than anything else, in addition to feedback, it's really the opportunity to network with people that are working in your space, in either in your country or across these countries, to build up opportunities for collaboration, to build opportunities to really just troubleshoot and stand and really kind of come to it together. Dr. Thein-Lemelson, I don't know if you had any additions to those.
Yeah, I absolutely agree with both Dr. Trang and Dr. Lesley's points. I think the goal is definitely to test out your ideas and see where they may land. And you may find individuals, you may connect with individuals, even senior researchers who connect with your ideas and who will help you elaborate on them or take them further. I think it's also very important to keep in mind that in terms of professional development, I think different societies have different educational systems have different emphases on public speaking and communication skills and presentation skills. And I know that traditionally in the public education system that's existed in Burma over the last 60 years or so, that has not been emphasized. But when you go out into the international community, those skills are emphasized. And I think it's beneficial to individuals to be able to communicate their ideas in an efficient and an articulate manner, and that this is what this type of conference affords you, that opportunity to practice those skills.
I think that's a great point, and that was, maybe I didn't say it as well as you did it, because you brought up the idea of the different sort of types of pedagogy are emphasized in different societies. And but yeah, that's what I meant sort of with the idea of communication and communicating to different audiences, is that you might not be that familiar with public speaking and you might not be that comfortable with public speaking. And I know the first time that I presented at an academic conference, I was really nervous and, probably did a terrible job, but that it was a great opportunity for me to build and to improve over time, and to also build my confidence in my ability to communicate my ideas.
I see that we have one question from Janita and then two questions in the chat. Janita, did you want to ask your question?
Yes. Can I just speak over this over here?
Yeah, absolutely. Yeah.
All right. So hi, good morning. My name is Janita and I'm from East Malaysia, Sabah. I hope some of you have heard about it. It's Borneo. It's in the Borneo. Actually, I came across this program in the social media, and my background is I am actually more into the social work, but more on volunteer basis. I am with this Befrienders Malaysia, or if it's worldwide, it's Samaritan. So we provide, our organizations, we provide emotional support through helpline. But I'm also an intern student, an adult student, in the psychology counseling, and
Oh.
I'm just waiting for graduations. So yes, so why I am interested here, one is because I'm so interested with this mentorship program, because I have not come across yet here in my country. Maybe there is, but I have not come across it. And then I see this an opportunity for me, because I have been trying to write, but I do not know whether this is the whether, you know, I don't have that skill of writing. Basically, I want to learn. So this program of providing a mentorship, I think, is a very good program for me, because mentorship provide a clear guidance of how to go about. And I think that is a platform whereby for us, a new into writing, to learn, you know. And this one we can learn just within the country, but even beyond Malaysia, which I think is, you know, when we interact with people from outside the country, there will be new learning, and this is what I want to tap. So I am interested into that, and I look forward for this opportunity. Surely I'll be signing for the mentorship, because I want to learn. Although in mental health, I have been with this mental health supporting program for almost 10 years. We have been helping people through the helpline. Even we conduct program in the schools, in the college. We create awareness program on how to take care of mental health. So I hope with my experience, I could add in value, and I would like to put that in writing, in fact, actually, because I had an experience. So maybe I can just add in, and maybe see how other countries is doing, you know, providing this. I'm not in the clinical, but I am more into the social work. So maybe I could provide some sharing on how we practice it here. So yes, so I'm looking forward for this, and to the organizers, thank you for this platform. I am looking forward for the mentors from other countries. It would be nice to see you all face to face next time, but then for the time being, online is good enough. Thank you.
Thank you so much. I'm so glad that you found the information through our efforts on social media, you know, so that's great to know that it's reaching people, and also in other countries, as I said, because we are hoping to expand to other countries. And I've done a little bit of research in Malaysia before, actually, although I haven't been in your area specifically. I was just in Kuala Lumpur, but I really enjoyed my time there. Yeah, so, but I think that your background, it sounds great. And you know, social work is definitely one of the areas that we're targeting. And we are actually looking into right now getting accreditation for the conference, so that people who are social workers and psychiatrists and psychologists in the United States can get credit for attending the conference, that goes toward the credits that are required for their professionalization. And so you may have an opportunity to actually network with other social workers from the United States.
Yes, and in some cases, accreditation might also translate to other countries, and we're also looking to that. But yes, really excited, and it would be amazing to have you presenting on those experiences, Shanita. Yeah, looking forward to interacting more. I think we also have two other questions in the chat, Elena.
Yes, one is, can you raise examples of clinical case study abstracts? I feel like I'm not the best qualified to answer this question. So Dr. Trang or Dr. Tyne Lemelson, I don't know if you have any thoughts about it or examples you might want to share.
Sure, I can think of some examples, and then Dr. Tyne Lemelson, if you have others, feel free to add them as well. But I think some examples might be, you know, if in the context of your clinical work, you're encountering, I guess, you know, you're noting interesting observations regarding how best to screen for certain problems, or if you're seeing certain ways that mental distress is presenting in the context that you're working, that might be perhaps different than how people would assume, or just different across these different sites that we're proposing. That could definitely be something that is that you could include. In other cases, it might not be at the screening level, but it might be at a more of a program level. So for instance, we all know, so in terms of how, for instance, you might treat some forms of mental health or psychosocial distress, perhaps you've ran certain programs and you've noticed there are certain barriers towards uptake, or just differences in terms of uptake, retention, or the impacts of the program on individuals in terms of promoting well-being, in terms of alleviating distress. You might not have formally studied it in the context of systematically studied it in the context of a study, but that you think this would be, that you have these observations that you're noting as a practitioner that would be applicable towards, that would be applicable or interesting to share with researchers in your field, or that you would like to just troubleshoot with other practitioners, other community-based leaders, either in your country or across countries, then we definitely welcome those as well. And you'll see actually in Dr. Lesley's slides, in one of the slides, she does provide some examples of along those lines of what like a clinical case study might look like. And if you have any doubts or just questions in general, feel free to really sign up for our abstract mentorship program, or shoot us a quick email. Dr. Thein-Lemelson, I don't know if you had anything to add.
I think it might be useful for us to post more examples of clinical case studies and different types of abstracts across different disciplines. I think that might be helpful for individuals. I think another thing to keep in mind with regard to clinical case studies is that you can have a case study of just one person and bring that in, and that is very, you don't have to feel like you have to have a large N or a large sample and reporting, and that you're reporting findings across many different cases. It's perfectly acceptable, and it's actually the norm in most psychiatric conferences to simply present data on a single case study and discuss conceptual issues related to that. And the conceptual issues can be quite abstract. I mean, it can be very specific symptomology, but it can also be more sort of phenomenological or experiential sort of data or observations that you might have.
Thanks. Yeah, that's great. Those are great descriptions. And as we mentioned before, we would also have mentors who are skilled in these areas. So if you want to write a clinical case study, we will pair you with someone who has that experience and can help advise you in that area. The next question we have is, while writing an abstract, can I add my personal point of view in the conclusion? Well, generally, I think that you wouldn't necessarily want to put a personal point of view, but an argument that is founded in your data. But I don't know if Dr. Trang or Dr. Thein-Lemelson, if you have a different idea.
It depends on your definition of personal.
Yeah, I guess that's true. I would like, it's an opinion piece. I don't know.
Right. I definitely agree with Dr. Thein-Lemelson there, that it really depends on what you mean by personal point of view. I think it needs to in some way have, emerge from the data and have some basis in your results and not be too left field, so to speak. But otherwise, I think definitely drawing on what you might think the significance of those findings or implications of those findings would be.
Yeah, so right, it could be personal in that sense. I guess I was trying to separate personal from your personal understanding of what the data means or what the implications are versus like your opinion or sort of personal likes and dislikes or something like that. And then I was also trying to think, well, what if it was a more sort of phenomenological study or autoethnography, for example, that could be a personal opinion. But I guess if you're unsure, once again, just sign up for the mentorship program and then they can give you some feedback on it. Are there any other questions? There are also a few questions that were asked last time that I can bring up just in case they cover anything that people haven't thought to ask. One was if the video will be available and where it will be available. Yes, it will be. And as was the case with the last webinar, we posted the video on the conference website in the news section. And we'll also be sharing it out through Facebook and any other venues. I think that's what we did last time.
Yeah, and just to also note that, we did an earlier iteration of this presentation that was also recorded and has been uploaded on YouTube, and actually subtitles in Vietnamese, Khmer, and Burmese will soon be available. And when it is, we'll be making announcement to everyone who had RSVP'd, including you guys, and making announcement on the Facebook page, on our website, and other social media.
Yes, yeah, and we're excited. We'll have those subtitles done very soon, actually. Thank you to the hard work of our conference staff. Someone had asked if there was a fee to attend the conference or submit papers. No, there is no fee. It's completely free. And also do keep in mind that if you don't feel that you have something to present at this point in time, you're still welcome to attend the conference. We're very happy to have people attend and to get their feedback and perspectives. And then someone had asked before if Asian countries other than our three sort of target countries of Cambodia, Vietnam, and Burma are eligible to participate. And as we mentioned before, yes, that is absolutely the case. We're happy to have participants from other countries, although we may not be able to provide conference materials in your native tongue, or in your language.
Oh, I think Dr. June has a question.
Yes, I want to ask a question on behalf of some Burmese folks who are interested in abstract submission. So as you all have noticed, there is ongoing political situations in the country, and before the coup happened, there were Burmese scholars working for their master degrees or doctorates and conducting their researches and collecting data samples, etc. And because of the coup, things got being put on hold. And for instance, like my own case, I was doing a research for my master degree, and I'm collecting my data, collecting the samples. So we have most of the master students who have who are conducting, they have completed their literature review, study method design, etc., but they cannot conclude the research yet. And there are many I believe there are many scholars in the mental health field, both from clinical background as well as from psychology background, in situations like that. So what do you recommend for those scholars who want to, who are interested in abstract submission for their ongoing researches, which cannot be concluded yet, and who want to participate in this conference? Yeah.
Thanks. That's a great and really important question. Dr. Zhang, I think we had sort of a similar question last time, and you answered it really well. So I don't know if you want to take a stab at it again.
Oh yeah, sure. I mean, and then, you guys can feel free to supplement that answer as well, which is that, we're perfectly welcoming of folks who either have preliminary findings or don't currently have findings. I mean, we completely welcome that as an abstract submission. So do not worry that, because the study was cut off before it was either initiated or either finished, that you can't submit an abstract. You can, and we highly encourage it, and would definitely want to see those folks at the conference. I think, if you have preliminary findings, then I think, definitely include those and present them, but no worries if you don't. I think for those that don't, when they're writing the abstract, it's just to really put emphasis onto that introduction, to put emphasis into the background, that literature review that you mentioned, as well as, some hypotheses that they might have, if they have any, into that abstract, and then in the results section to mention any analysis that they anticipate doing or would do should they have those data, and we'll review it as is. And I think it can also be a valuable opportunity for those folks at that stage to present at the conference and receive feedback on their current design. Dr. Thang Lemelson, did you have anything to add to that?
Yeah, I think this is actually maybe a potential opportunity if there are many such individuals, which it sounds like there are, that the coup sort of happened and then everyone was just kind of left in the middle of data collection or lit review and unable to finish their master's thesis. I wonder if it's even an opportunity to gather all those individuals and mentor them and have a very specific even panel devoted to, research under duress or under political violence or something like that, which is a theme that may cut across more than Burma and across Southeast Asia more broadly. So I think that was a really excellent question. And I think, I think one of the, wonderful aspects of this conference is that it will afford individuals like that the opportunity to present their research to an international audience too.
Yeah, I think that's a great point. I think that if we get a number of people who are in the same situation, we can put together a special panel or even several panels that are devoted specifically to those issues. And not even just related to the coup, but as a result of COVID-19, a lot of people probably know that a lot of research projects were halted. And it was an issue that I actually confronted with my students when I was teaching an anthropology class at the start of the pandemic, that they were sort of halfway through the semester and halfway through these research projects. And we basically ended up doing what Dr. Trang suggested, which is focusing more on the literature review and the hypotheses. And then they talked a little bit about some preliminary data they had collected and sort of where they were planning to go from there, had they been able to do that, but and had their research not been disrupted by the pandemic.
Yes, thank you. Thank you all for your encouragement and your suggestion, because I can see some of my colleagues who are working towards their master thesis in this conference, in this meeting. So I believe this will encourage them to subtract their abstract in this conference. Thank you, everyone.
Thank you. That's wonderful. Great. Well, if we don't have any other questions, I think we will probably conclude for this session.
All right. Well, thank you, everyone. Thank you so much to everyone. I'm happy to see that while doing this presentation, we've had 4 more people, I think, attendees sign up for abstract mentorship. So that's wonderful to see.
That's great.
And yeah, we'll be matching you to your mentors very soon. Per usual, I'd like to conclude just by taking a group picture. If you don't want, your picture, if you don't want to be on camera, feel free to turn off your video. But those who want to be part of the group picture, please turn on your video and I will take a picture. In maybe 1, 2, I'll count towards 10. How's that?
Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, smile for the camera, guys. It's great to see your faces. All right, thank you so much, everyone. We'll be in touch with recordings and links, and hope to see you guys again soon. Bye.
Thank you, organizers.
Thank you.
Thank you, everyone.